Hi everyone, it's Nina Collins here at the Woolfer, and we're here today with Dr. Suzzane Gilberg-Lenz from LA, and we're going to talk about incontinence. Welcome, Suzzane. It's nice.
Yay! Thanks for having me, Nina.
Yeah, I'll give a quick little bio of Suzzane, who I know already. She's an OB/GYN specialist in Beverly Hills. She has over 24 years of experience. She has a website called The Dr. Suzzane, which is THEDRSUZAANE.com. And she has a newsletter and she has quite an Instagram following. And she also, her practice, she does traditional medicine, but she also graduated from the California College of Ayurveda. So she has a real interest in holistic medicine as well. And we're just fans in general. And one of the things I realized recently when we did a recent panel, we did the health panel last week for the Cusp on kind of women our age and menopause. And the women really loved the panel. We had 4 doctors, but a lot of people came back to me and said, oh my God, that was too much information too quickly. And I need like a real 101. So I said, okay, fine. We're going to start doing more really basic 101s.
Yeah. Yeah.
So you can talk about a million different things, but today I'm just going to ask you to talk about peeing issues.
Yes. Yes.
And there are a lot of peeing issues. So like I, for example, am having some pelvic floor dysfunction. I'm having those muscle spasms. I'm not having but I'm not having incontinence, which is specifically what we want to talk about.
Right.
So maybe we could start by you telling us a little bit the basics about why women our age, so women over 40, women in perimenopause, women in menopause, why a lot of us, and maybe you can give us a sense of how many of us struggle with incontinence issues.
Yeah. Well, first of all, over the course of our lifetime, up to 50% of women are going to have some episodes of incontinence. And incontinence is just involuntary loss of urine. So normally, the way we hold our urine is a combination of conscious and unconscious control. We have a series of muscles that keep the bladder closed off from the rest of the world, but we've all had the experience, we're probably all doing it now. We all have the experience of knowing that we would like to pee, but we don't want to pee. We can't pee right now, so we can hold it in.
Right.
What happens as we age is a combination of things. And a lot of it depends on genetics, our body type, what other bodily experiences that we've had. Did we have, pregnancies? Did we push for 4 hours? Because we have the bladder itself, and then we have the pelvic floor, which is this sling of muscles that literally holds up your entire body. And the urinary tract, the urethra passes through part of it, the vagina passes through, and the rectum, the sigmoid colon, also passes through. So there needs to be room, and there needs to be the ability, like all muscles, to kind of move and change and respond to the environment. As we age, those muscles, like all muscles, if we don't work them out, get weaker. And like I said, if you've had other experiences in our lives that have weakened them, far more people have damage to the pelvic floor during pregnancy, whether or not you have a vaginal delivery, by the way, than realize this. And if we're not consciously aware of how do we keep it strong, the bladder kind of collapses through, the angle between the bladder and the urethra changes. And the most common form of incontinence we see is what's called stress incontinence. So cough, sneeze, laugh, jump, exercise, dancing, that it pushes down, and instead of the pelvic floor pushing back up and maintaining position, it doesn't. And now we leak. So that's just, as we get older, it's all those life experiences that add to that. So that becomes a big issue. And, just to give you like scope of this problem, and I haven't looked at the numbers for a minute, but the incontinence product market is almost $1 billion a year market.
Wow. So this is like really common.
So oh my God, men and women. We're talking more about women here.
Yeah.
Like I said, almost 50% of us are going to experience some kind of incontinence. A lot of times people will get it immediately after birth.
Yeah.
But women who've never had a pregnancy will have it as well. So it can get worse. And I think one of the biggest problems we see is that people don't talk about it.
Right. Like so many women.
Yeah. And if they don't talk, if the patient doesn't bring it up to their provider, and the provider, we don't ask, because we're like, oh, God, we got 3 minutes till the next patient. Or if we think that we don't know what the answer is, we don't like to necessarily bring up stuff that we don't feel like we can fix.
Yeah.
So it's just a bad problem. And there's lots of data on this, like at least 40% of women who are experiencing incontinence never even bring it up.
Yeah, no, I have a friend who's really struggling with it and told me she's never brought it up. And there's also the problem then of which doctor do you see? Because I did
Right.
find when I started having some peeing issues, my gynecologist kept trying to fix it, but I really needed to see a urologist and
Yeah.
I needed
Yeah.
to see a pelvic floor specialist.
Yeah.
And I had a very good gynecologist at the time, and I was super surprised that she didn't refer me to a pelvic floor
Well,
specialist.
I think this is a more global problem, and you and I have talked about this before, and I think we talked about it a little bit on the panel. I mean, this is a bigger global issue where people want to own everything and do be all things to all people, and that's not realistic, and it's not necessary. I don't think our patients actually expect that of us,
No,
and I think it's just not doing the right thing for people.
no, I mean,
So
it's a huge
it's
gift.
pretty common. It's common. It's very, very common. And then I think the other thing that happens is a lot of times when women don't go to a gynecologist who specializes in urologic problems, or a urologist who specializes in female urology specifically, they're going to get dismissed also,
Right.
sadly. So even, and look, you and I live in, big metropolitan areas where there's lots and lots of specialists. If you're in a smaller community where maybe that doesn't even exist, it may be problematic. The other thing that happens is that, even the 20% of women or so who will undergo surgery, there's a fairly high failure rate for those surgeries. So I
I,
think people,
I was about
surgery
to
is not
ask,
always the end all and be all.
yeah, when you talk about surgery, are you talking about that sling thing that people say is a huge?
That's one of the things that it can be done,
Okay,
but
so wait,
essentially repairs to that tissue.
let's back it because it sounds, I mean, it's fascinating. Your explanation of the pelvic floor is actually really helpful to me to
Yes.
imagine this kind of whole carriage that's
Yeah.
underneath all of these muscles. And
Yeah.
it explains to me a little bit more visually why there's so many different things that can go wrong.
Yes.
But if specifically you're having, so the main kinds of incontinence are stress incontinence and there's urge, right?
It's
There's
urge incontinence. So urge incontinence is different. Urge incontinence really doesn't have anything to do with the pelvic floor. It has to do with the intrinsic musculature in the bladder. And the bladder itself is not under voluntary control. And I'm wondering, when you were talking about your thing, but that also increases with age. And I don't know if we totally understand that. I mean, I have some theories about it, which I will share, but it almost becomes overactive and twitchy. And it's like, I have patients who will describe to me, the minute their keys come out of their purse to get toward the door, they're peeing. It's like this it's horrible. It's horrible, and these are the people who can't go, they're planning every trip. How long can they go without, like, once they feel it, that's it, they gotta go, they cannot hold it. And it's not even about bladder capacity. Those little muscles on the bladder itself, which is like a balloon that should be able to blow up, get to a certain point, and then signal you, like, you better go, but you can hold it, right? Because you can hold these muscles down here. Somehow it's misfiring and it's overreacting, and it's just going, and you cannot stop it. That's very disturbing. That's not going to be really effectively treated by dealing with the pelvic floor. And I think as we get into perimenopause and menopause, and our estrogen levels are fluctuating and then dipping. Estrogen is a lubricant in many ways. Estrogen is dependent on proper blood flow. Estrogen is an anti-inflammatory molecule, and we see a lot of inflammation that increases throughout the body as we get into perimenopause and menopause. And so for sure, I don't know if people realize that the urinary tract also is very, very sensitive to estrogen and to female hormones and to our cycles. And so as that starts to change, that benefit is lost. You get a lot of dryness in the urethra. People feel like they have UTIs, bladder infections, even when they don't have them. So all of this I know, living the dream with you, so these are things, and this is where some local therapy may be helpful, honestly, for people who have really severe urge incontinence, or what we call overactive bladder, OAB. Honestly, this is where pharmaceuticals work better. Although I'm going to tell you, a lot of people hate them because they dry you up, which means they dry everything up.
So
but I've had patients be like, okay, I got to go to Disneyland with the grandkids. I'm going to take this medicine today.
Got it. So there's a medicine that literally just kind of stops you from having to pee so much.
Yeah.
Just kind of.
But it's going to constipate you, give you dry mouth, give you dry eyes.
Oh, that sounds horrible.
No, it's kind of awful.
God, but I can see in an emergency, you have your
Yeah.
daughter's wedding or whatever.
Right.
Or you
This is where I think holistic medicine can really shine. And I don't practice Ayurveda, but we have in Ayurveda or Chinese medicine, any other non-Western paradigm, which is always weird to me when people crap on it, because it's like, I don't understand why we think what we've been doing for 5 years or 50 years trumps something that has been going on for literally 6,000 years. But okay, but we don't have evidence. So, okay.
I'm a huge acupuncture fan.
I'm a huge fan of whatever works.
Yeah.
The paradigm is completely different. And if you look at it from the Ayurvedic perspective, which we could do a whole 4 hours on that, we're having a shift in our constitution. We're just going to put it like, I'm going to speak English, not Ayurveda, right? So our body is, we know this, right? So we have more dryness coming in, and there are things that you could do from the Ayurvedic perspective that would increase moisture, that would decrease the inflammation. And I want people to be very careful. Like if you want to do this, you should find a trained professional, but certain herbs licorice is a good one that we use. Marshmallow, things that are moisturizing, that are going to bring fluid and balance the deficiency or the imbalance from the Ayurvedic perspective, could be helpful for overactive bladder. I think herbal medicine might be very helpful to women who are experiencing this.
That's interesting. All right, I'm taking a note.
Again, no, I can't prove it.
Yeah.
But,
and when I've read about women who pee during sex, which must really suck, because particularly if you're with someone new, it's got to be super embarrassing, and it probably.
Well, there's a lot of web capacity bandwidth devoted to squirting. So I mean, I don't know. I feel like you could turn it into a win.
You could turn it into a win. That's a very good point. I'm jealous of people who squirt, but I also
totally. What's up with that?
I've never squirted. I don't know, maybe one day, but I am jealous. And there are women who talk about it happening in menopause. Like menopause made them start squirting. And that's not what we're talking about. That sounds fun.
It's like a really hard left turn, but that's me.
Leaking little bits of urine during sex would kind of be a drag. And I'm wondering, is that overactive bladder? Or is that stress incontinence? Or is it not clear?
It's probably a combination of the two, because if you're having an orgasm, you're having, so I don't know if it's during orgasm or just in general. Some of it's probably stress incontinence because the bladder position is different. And as you're moving around, the sphincter, that muscle, that little circular muscle that should keep that area closed off, is opening. That's probably the bigger issue.
I see.
Yeah.
Okay.
Yeah.
So with overactive bladder, you're saying there are medications that will kind of dry you up that you can use if you're desperate. There's also obviously Depends or some sort of
Right.
There's then the herbal medicine route. For stress incontinence, what are the common treatments? What really works?
So aside from surgery, and I never would go straight to surgery unless somebody has like really severe prolapse. Okay, when I can see that your bladder, your organs, your uterus, your cervix are descending and moving down really low, we're probably beyond what you could do in terms of strengthening the muscles. Pelvic floor physical therapy can be amazing for strengthening those muscles, for just identifying them. Most people, a lot of times I'll do an exam, and I try to always be careful about asking, because like I said, like a lot of patients aren't going to answer or aren't going to ask me. So I bring it up, and I have them with my gloved hand. I have them squeeze down on me. And it's really interesting. I mean, some people do great. Some people there's some areas that are really pretty strong. And typically in the front where the bladder is where it's the weakest. So a lot of people can't even do anything. They can't even make that connection anymore. They're disconnected from that. So working with a trained physical therapist who really knows about the pelvic floor, it's very specific. They can sort of reestablish that connection and then start to strengthen the floor, just like any other workout.
Wow.
There's weights you can use. There's all sorts of things you can do. I really love the non-surgical approach that uses that same concept. It's called HIFEM. It's high intensity. I always screw this up. It's electromagnetic, blah, blah. Anyways, it's basically, it's a chair you sit on completely clothed, and it creates contractions. It's a current. It's not painful. It's a current, it's a 28-minute session, and it works out your pelvic floor. And you're going to get way more pelvic floor contractions in a 28-minute session on
I've
this
never heard
Emsella
of
chair. It's wild.
Wait,
It's really great.
it's called
Emsella, Emsella. And
EM.
it can buy people time. And for a lot of people, it works great. I find if they're going to do it, it's not one session. We usually recommend, 6 to 8 sessions. But again, you're sitting there fully clothed, nobody's sticking their hand in you, and there's no surgery, there's no downtime. If you do that and you do some pelvic floor physical therapy, because it'd be, Nina, akin to going to the gym, working out crazy hard, and then never going back. Like, what do you think is going to happen? You're going to lose it.
Right.
But if you now can identify those muscles, you can have a relationship with your body that works better, and you've worked it out. Sometimes that really works very, very well. I will tell you, the studies are thin, they're small, they're clinical studies, they're not big pharma with 10,000 people, but they're pretty promising. I mean, there's a guy here in Southern California, Red Alan Saad, he's published quite a bit. People experience maybe 50 to 80, 90% improvement. A lot of people walk out of there with at least some kind of improvement. And the biggest thing is they report a real improvement in their quality of life. So that's awesome. That's a great option for people.
That's amazing. So you said it's called HiFem?
The technology is HiFem.
Okay, and it's called Emsella.
I think this is the only product that's out there. Typically, there are a lot of other things that people are using now, and I know that some of my colleagues really don't like these things, and I mean, that's okay. They don't have to. We don't all have to agree on everything.
We don't all have to
but
like
it's okay. It's a big, big world. I personally like a lot of the lasers and the radio frequency, and they all do different things. I think what happens is people are oversold on what these things are going to do, and people are not precise enough in their use of the machines. And the CO2 lasers, the Mona Lisas, those things, that's very superficial. That's for vaginal dryness. Okay. The radio frequency, and by the way, a lot of this came from aesthetics.
Yeah, no, I was about to say some of these are only, like, I've used the V-Fit. Some of them are only approved as wellness devices, not medical devices.
Well, exactly. The device is approved, but the indication is not.
Right.
And this is why I think it's so important, if you're going to do these things, don't have your dermatologist be putting shit in your vagina. I'm sorry. Let a gynecologist do it. I know what I'm doing with your vagina. Okay. So radio frequency, a little deeper level, collagen production. There's some clinical studies showing maybe it improves incontinence. If you have stress incontinence, I just explained to you why it happens. It's not about collagen. Collagen will help a little bit. It's the muscles. So
I want to go back for 1 second because I want to understand what the surgery does. So
it actually repositions. It goes inside and it can put the fascia and the muscles back together. Because frequently what has happened is the muscles have weakened, and the fascia, which, if you guys, it's that silver skin stuff. That's what really holds our bodies together. The fascia frequently is quite damaged as we age. And if we don't, they will actually sew that back together.
Oh, interesting. Oh, that does sound like it could be helpful.
For sure. For the right people, it is absolutely helpful. But like I said, frequently it breaks down too. Not frequently, that's not fair. I think it's something like 15 to 20% of the time people are gonna need to either have another operation, which is complicated, or it's not gonna hold up. As we get older, we also respond to surgery differently. Right. As we get into menopause, if we're not using vaginal estrogen, our tissue isn't going to heal as well. So there are a lot of layers to this that people need to understand, so that they can approach who they have been led to, whatever this expert is, and really ask questions that make sense.
Yeah, it's very complicated, because my next question for you, so the issue that I'm having is muscle spasm. So like my muscles are tightening, right? So I was told not to Kegel. Right. And in fact, I was wondering, I used Benoit balls this summer because I discovered them and thought they were really fun. And I wonder if they contributed. I'd had one bout like a year ago, then nothing for a year. Then it happened again this summer. So like this Emsella chair, like, because some women are not supposed to be.
I wouldn't, for someone like you, I would do pelvic floor physical therapy, because you have something called hypertonic muscles. They're overly tight. And so you can imagine it hurts. So
I mean,
this is where,
I'm not having a problem with sex. It's not like my boyfriend's complaining I'm too tight or something.
right, right, right.
Oh, this was actually super interesting. When I went to see the pelvic, I mean, you know all about this, but I didn't know. When I went to see the pelvic floor specialist and she put her hand up inside me, it was so interesting. She was like feeling around and she could tell me where the muscles were tight. Like it never
Yes.
occurred to me. It's completely, so it was like,
Well, that now that you have this visual, I
yeah,
wish I would have brought my anatomy book from medical school. It's pretty wild. There's a ton there's all these big and small muscles, and they're attaching to the whole. If you guys, probably have seen
yeah, like
the pelvis, the
yeah,
whole bottom of the pelvis is networked with muscles. So that's so everywhere, all over. It's really, it's
yeah,
holding your pelvis together. It's keeping your femur bones, your thigh bones in line. It's helping you open and close and up and down. And, it's affected by the big muscle groups in your spine, your psoas, your hip flexors. I mean, I feel like I don't know, because I have a background in fitness and yoga as well. I really understand this stuff too. And I got to tell you, it's helped me a ton
yeah, no, I'm sure.
because anything we feel below our belly button, my ovaries hurt. I mean, it could be your ovary. Can I tell you how often, this is off topic, but it's related, because it shows how much we don't know our bodies and how out of touch we are with our bodies. So for you to go to the pelvic floor physical therapist and her to identify, like, how great for you
It
to
was so
understand
cool.
your body better.
Because I've had a recurring pain in my left hip on and off for over the years, and it's on my left side in my vagina. Like she said, it's probably connected to your hip, and she wants me to have an MRI on the hip. But it was just really interesting to see how isolated it was. Because again, it's
Mm-hmm.
not like I'm experiencing, I don't have vaginismus. My vagina
Mm-hmm.
is closed shut, but I am
Right.
having this spasming inside.
Yeah. 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 Well, there's amazing stuff you can do for that too. So the therapy can help to sort of relax, almost like massage.
Yeah.
I mean, this is where I think CBD is huge. Cannabis-based vaginal suppositories. Oh my God, amazing for
Oh,
relaxation. Do you know that with a compounding pharmacy, again, people, want to poo. Well, where are they, you can make vaginal Valium.
no, so I've been taking that. I've been using
It's
that,
magic.
which
It's magic.
there are no two funnier words together than vaginal Valium. It makes I used to think vaginal atrophy was funny. Now I think vaginal Valium is funnier. But no one has suggested CBD suppositories. That's a
Because
really
it's not out there that much. And I think that because the whole cannabis industry is so patchwork and it's the Wild West, here in California, first of all, it's California.
right. You have to.
And second of all, it's California. And third of all, it's California. And then also we have, medical and recreational marijuana is legal in this state. So we have different access. But I know and look, with products, any non-FDA approved product, all the nutraceuticals, which are regulated completely differently. I am so strict about who I refer to. I don't tell my patients use this herb. I tell them what brand to get,
Yeah,
because I
no,
know who's clean, who's really following, the regulations.
no, that
I
makes a
think
lot of
this
sense.
is going to be an emerging field. The pelvic floor, it turns out, has one of the highest concentrations of cannabis receptors in our body, the
Huh?
pelvic girdle. So it's great for relaxation, for sexual pleasure, for cramps, for endometriosis. I mean, is there data on it? No, it's going to take a very long time for this to emerge because of federal funding guidelines and research guidelines. But I know of a couple of companies that I really trust and I really like. And I know that one here in California, it's called Foria for Pleasure. I think to buy online, you have to be either in California or Colorado. But they are amazing, and they were working with a Harvard-based physician on research in this area. So it's going to happen.
That's really good. Foria, we know as a great lube company, and I didn't know they make.
They make suppositories too, and they don't market it this way because they can't. But I know you could use it that way, and I've done work with them. So yeah.
That's great to know. I'm
Mm-hmm.
going to definitely get someone to get me some,
Mm-hmm.
or I'll go to California or whatever. All right,
You
so
could MacGyver it too.
say it again.
You could MacGyver that one. I
Yeah,
mean, I'll just leave it at that.
probably could. Okay, that's a thought. Um, All right, so we've covered stress incontinence, which are all the weak muscles, which, oh, you didn't tell me about the sling, because the sling gets
The sling. So we talked about the surgical procedures. A lot of those procedures are designed to put the tissue back together. For a lot of people, that tissue just really isn't going to be strong enough. The integrity of the tissue isn't good enough. And so they will actually put a piece of either, actually, what we started in the beginning with was fascia, like we talked about, taking fascia from a cadaver, because that fascia is really strong still, and inserting that, and meshes have been used for slings. This has been controversial because there were definitely some problems there. I think it's unfortunate because throwing the baby out with the bathwater is just never a great idea. And I'm sure like now we'll all get like an ad in our feed about, were you harmed by mesh?
right,
But
exactly.
I think to say like out of hand that a sling or a mesh is evil is, I don't think it's accurate. Again, it's all about who are you working with? Are you working with somebody like Dr. Elizabeth Cavalier, who's a really good surgeon and has a lot of experience, and this is her area? Or are
Yeah.
you working with, general gynecologist,
No, I would say
ABC, who does two
I,
a year?
I would
You know,
trust
and
Cavalier with
and for these surgeries, we know that the more you do, like, so for people who specialize in these surgeries, they're doing lots and lots of them. And it's all about volume. If you do a lot of them, you're going to be better at them.
right, right. That's always a good rule of thumb with surgery,
Yeah.
for sure. All right. Well, so a lot of incontinence and diapers. Do a lot of your patients wear?
I
Depends.
think probably more people wear incontinence products than talk about because they're embarrassed about it. But I will say, like, there should be no shame in using an incontinence product. And here's where I really want people to understand something. So, full disclosure, I am currently working with a company called Tenna. This is not a Tenna sponsored event, but they are like the Depends of Europe.
Oh,
And
how do you spell it?
TENA. They're great. They're coming for Depends. But they're really cool. I've really learned a lot from them because, I think people are embarrassed to go down the incontinence aisle and they're still reaching for their period products, and they're not the same. Those are designed for blood, not for urine. So
Yes.
urine needs to be wicked away from your body. You need to keep the area dry. It can't stay moist, especially as we're getting older. If you're in menopause or perimenopause, the combination of having some vulvar dryness and changes from our estrogen loss, plus sitting in an acidic urine, that's a disaster. You're going to have pain, you're going to have infections. So wearing the wrong product is really a big problem. And so if
Yeah.
people are leaking in between, or they get some relief from the things they're doing, but it's not perfect, wear a pad. Just wear the right pad. Like,
Right.
trust me,
We're the right.
nobody's watching you in CVS.
No.
Nobody. They're
No one
looking at their own
cares.
list.
No, it's another big lesson in life that you learn as you get older, right? No one's really paying attention to you.
No one cares.
We did a small project with a company called Ladybird last year, which is a new incontinence product, and they explained all that to us too. That the material used for period products is different from incontinence.
Yeah.
You need an incontinence product.
Very, very important. Yeah.
Um, wow. So up to 50% of all women will experience incontinence. And Lilybird, sorry, thank you.
Yeah.
Sydney corrected me, not Ladybird. That was the
Yeah.
movie. Lily,
Right.
thank you. Um, Up to 50% of women will experience incontinence. So there's surgery, there are drugs. I think the biggest message for me about this conversation, it's really been a revelation in the last year, just learning about it, is how complicated that part of our body is.
Mhm.
And it seems hard. I mean, I guess it's not hard for you guys. It seems hard for me to diagnose. Like my big fear when I started having problem was that I was having what is it, that is it cystitis? No, it's that thing that's like where you have chronic super
Oh,
pain.
interstitial cystitis.
Oh, I was really scared. Tell us briefly what that is.
Well, that's kind of a mystery too, but it is an inflammatory process, and that tends to start much earlier in life. But we do see it happen in middle-aged women too. And like I said, my suspicion is because as we get more kind of dryness and inflammation, we're getting, it's similar to that overactive bladder, except for that it doesn't necessarily result in urine loss, but painful urine, pain. Anything that's in the bladder is painful, and you will see actual inflammation frequently in the mucosa, in the lining. So when they do something called cystoscopy, they put a camera into your urethra and they can see there's some very specific lesions and changes that we'll see in the tissue. But it can be very, very disabling. I mean, really problematic, and it can be very thorny to treat. I mean, there's all sorts of things. There's medications. There's actually instilling medications directly into the bladder. Botox has been used, biofeedback. There are implant devices where they can put like almost like a pacemaker that will diminish the amount of activity. But it can be really, really disruptive. And we do see it, interestingly, women who have endometriosis, there's some crossover with endometriosis and with interstitial cystitis. So endometriosis is where you have tissue similar to the lining of your uterus growing outside of that area, cycling, and then having no way to escape, getting stuck, causing pain, causing inflammation, causing scar tissue. It's, again, we don't know why these things happen.
Mm-hmm.
It's, you know.
As someone said the other day, a study came out about, you probably saw it this week, because it's menopause month, obviously. It's National
Right.
Menopause Month, and there are all these NAMS, North American Menopause Society studies coming out, and someone posted in our community a study about if you have 2 or more menopause symptoms, you're more likely to have increased chances of heart disease, right, or stroke. And someone commented and said, yeah, and as you get older, you're more likely to have increased risk of all sorts of things going bad. Like, this is just life. There's all sorts of shit that's going to go on. But all right, to the end point, we're going to wrap up by saying it's super complicated. And I think the main takeaways are, if you're having symptoms, do not be afraid to talk about it. Do not be ashamed, do not be shy. And you have to get the right kind of help. You hopefully have a good gynecologist, but I agree with you, Suzzane. I worry about people in remote parts of the country. Like in New York, I can find 10 great pelvic floor specialists. But you need to speak.
But this is where telemedicine is really shining. And even though you can't really you can't replace the hands-on physical therapy, but there's a lot of stuff people can do online. They can access great experts online now. And I think the other really important takeaway is, if you're not getting a satisfactory answer, like, go somewhere else.
Yeah.
Keep asking, or come to communities like this and find out what other people have done. I mean, we have to be here for each other. We are here for each other.
We are here for each other. And I really, really agree with that. And I think, definitely the best thing about COVID has been the emergence or acceptance of telemed, because telemed is awesome. And I agree with you. Like, I can sit here on video with you and describe my symptoms, and what's going on. And to me, it's a huge mystery. Like, I didn't know if I had, whatever.
Right.
So get the right help. The right help is out there. Thank you. You're an angel. You know so much. I love it.
Was so fun. I love talking about this weird stuff. Thanks for having me.
So enjoy your fall and everything, and we'll keep talking.
Yeah.